Hello, everyone. Thanks for joining us today on our SSJ at Home video talk with Father Pat, our pastor. And Father Pat, we've talked about it numerous times, and we set out each time we do a video to talk about other things, but COVID seems to bump its way to the top invariably. The Harris County judge has come out today, Friday, and told us how extremely serious the situation has become again for all of us. It's a hot spot we are in this region, I guess, and now it has hit it particularly close to home.
Yeah, unfortunately, it has. We had one of our staff members this week who was diagnosed with the COVID-19. So, we do just ask for everyone's prayers, right? We need to really pray for them and for the rest of our staff. Fortunately, most of us didn't have close contact with him, but there were a number of members of our staff that did have close contact with them. They are self-quarantining and then are being tested. So we just pray that others aren't affected. But I do pray for the staff member who has been infected by this. COVID-19 is a brutal disease, and so we pray for him quite heavily here in this time. But it is a warning, right? When we started opening back up, I mentioned then about how it was so easy to kind of fall into a cavalier attitude about the disease, because I think one time in one of the newsletters you put out a poll, right, of who knew someone, right, and people around here just didn't even know someone, right, even someone in New York or someone somewhere else that had gotten the disease, much less died from the disease. But now in these last couple of weeks, I was already starting to get more concerned, because you were hearing stories of things hitting closer to home, and now that it hits this close, right? It's for me, it's a wake up call, right? Just about the precautions we need to take. And we're gonna have mass this weekend. We're gonna have mass at all the times. I feel very comfortable about the precautions that we're taking in church with the wearing of the mask and the social distancing. And I think the precautions we take are good. I still discourage those who are vulnerable, who are more vulnerable from coming to mass. But the younger, the people who are more fit, they should and can come to mass, and we'll take every safeguard that we can, knowing that there is some risk. I'm confident. I'm confident that Father Kalis and I both have not had what they call close contact, right, which is defined as 5 minutes with someone without the mask on, right, in close proximity. And I'm confident that any contact we've had was uh, a passing contact, and we've been very good about wearing face masks and keeping it so. So I'm very confident there, but there's always a risk, and so I just want people to consider that risk, and as I've been saying all along, make prudent decisions. Right? We will continue to offer the live stream mass at noon, and those that are more vulnerable, I encourage you to join us at that noon mass. Mm-hmm.
And we'll reissue that survey that you mentioned sometime this coming week, and make comparisons. But I'll bet you the numbers are different, and I'll bet you that there are a lot of people that are familiar with the people who have suffered directly from COVID at this point. So.
Yeah,
And
all along with this, we've been getting feedback from people in the medical profession, people that have actually witnessed cases in the hospital and things like that. And what consistently the reports that come back, right, are for those that are hospitalized. For those, this is a vicious disease, right? I mean, we can get cavalier about it, and I think a lot of the spike in the population, they say it's younger people, and while the hospitalizations have gone up, they haven't gone up at the same rate that the spike in the number of cases has gone up. So, I think it's younger, healthier people, and a lot of those cases, we thank God, right? The mortality rate seems to still remain low, and so we thank God for that. But this is a disease that we can be complacent about, right? That um, for many, when they get the disease, it's they they don't even, sometimes I guess they don't even know they have it. But for those who are more vulnerable, it's a vicious disease, and we need to take the proper precautions to protect those that are more vulnerable.
we spoke yesterday with Montgomery County Health District Office, trying to get some information on where to find testing outlets for folks who would like to be tested. And the woman who I spoke with yesterday told me they were extremely busy, and to expect, if people who called in, they could expect either non-answers. Um, I hate to call them hang-ups, disconnects, because the volume of calls are so great that they can only tell people through other means of communicating, such as this one, to keep trying, and eventually you'll get through and have your questions answered. So
Yeah, so we keep hearing reports, right, about varied responses on the testing and all. And um, so, like I said, some of our staff has scheduled it. Some of our staff went out and found a spot and were tested and got a response back quickly. Others have, okay, you got to wait a week to get an appointment, and so it's highly varied. But that's where we're all taking extra precautions now in self-quarantining and just making sure that we wear the mask and the social distancing and all of those standards. And one of the things that we've implemented with the mass is at the mass is that myself and Father Kalitz and our other ministers, our other clergy, we're all going to take our temperature before the mass, and just make sure that if there's any sign, or if getting starting to feel bad, if there's a temperature spike or anything, that we take those extra precautions immediately.
okay, Father, thanks for your time. I know that you'll keep us updated, and we'll talk to you again early next week.
And please keep our staff member and all of our staff and all of those who are suffering in your prayers.
Thanks, Father.